Good afternoon. Today we will cover Chapter 3 and just wanted to do an overview on Chapter 2. However, we will at length go over Chapter 3. But Chapter 2, please make sure that you read Chapter 2. Chapter 2 gives an overview of the historical perspective of substance abuse and the early history. So it goes back to 5000 BC, as early as 5000 BC, and it brings you all the way up into the 2000s, the century of the 2000s. But some of the important aspects that I wanted to talk about just with the historical perspective is how some of the traditions and cultural traditions, and then in different parts of the world, alcoholism, substance abuse, and dependency was looked upon very differently. For instance, in North America, we had the Mayflower, and so more beer was utilized during that time than water when we consider the Mayflower. Your text also talks about how slaves were forbidden to drink alcohol except for special occasions, and they were taught to binge. The Puritans tradition your book talks about, and then it even goes into talk about the 18th century where the Quakers and the Methodists disapproved of hard liquor. Then during the 1925 through 1919 was called the temperance movement, and this movement, they were very against hard liquor. However, beer and wine were the exception. The temperance movement also considered alcohol as the enemy of the family and its contribution to poverty, violence. And so that movement led to the women's suffrage. And so they believed that during this time, men were not able to actually handle their consumption of alcohol, and it led to very abusive and violence within the family homes. Also, during the early 1900s, moving into the 1900s, then we know Coke was identified as having some substances of cocaine in it. We know tobacco was outlawed for a brief period of time during the early 1900s. Your text does talk about the Harrison Act, the 1914 Harrison Act, and this act was really originated from the fear of foreigners drinking alcohol, and then it also talked about the restriction of opioids and cocaine. And now we know that those substances have to be prescribed now. Also, marijuana use was associated with Mexicans, which also led to the Marijuana Tax Act and other harsh laws that were instituted during the early 1900s. Then we know we move over to the history of gambling. Your text jumps into the history of gambling and how gambling originated in the U.S. and all of the problems that gambling caused in the U.S. We know the institution of casinos in gambling in Nevada was around 1931-32. I think your text makes reference to. Also, the 1960, you had lotteries that were on the rise, and that was for state revenue, to help states with state revenue. So then you had lotteries, which also some consider a form of addiction, because people were really dependent on this behavior. And we will talk about in Chapter 3 a little bit about the biology of addiction and how addiction has to do with the brain functioning and compulsive behaviors. Then we moved into 1972, where the first gambling treatment was instituted in Ohio. 1987, the Supreme Court banned the regulation of tribal casinos. So then in tribal areas, casinos were banned. And then we saw an explosion of the Mississippi River casinos, which is close to Louisiana. We saw an influx of Mississippi River casinos. And then now today, more prevalent, we have what's called internet gambling. And so we have a lot of internet gambling that happens today. And so some of the themes that were talked about in the first part of chapter 2 in the first half was really the dangers of potential alcohol, the role of ethnic prejudice that took place in shaping the drug legislation, and unintended consequences of prohibition. Also examples of how Italians family were happier with enjoying their meals, because we know that most Italians drink wine with almost every meal that they have. And also the early part of chapter 2 discussed modern war on drugs, and 2/3 of the money was utilized for law enforcement. When we talk about history of addiction treatment, we know your text talks about Mr. William White, who made reference to the terminology slaying the dragon, and this was mistreatment of persons with mental illness and alcoholics in asylums. So definitely pay attention to the terminology slaying the dragon. Also, getting better. Dr. Bill W. and Dr. Bob were from the Oxford group, and they wrote what's called the Big Book, and now Big Book and really was the foundation of AA, Alcoholics Anonymous. And now we have really over 2 million members in AA worldwide today. And so Bill W. and Dr. Bob were really the founders of Alcoholics Anonymous. Jellinek, he was one that coined the disease concept in the early 1960s, and he talked about 5 different types alcoholism was based upon. And so he talked about the alpha, the beta, the gamma, the delta, and the epsilon were the 5 different types of alcoholism. I'm sorry. And so the treatment history continued. Your book mentions the AMA, which is American Medical Association, and this is an association that focuses on the scientific needs that address pathology and symptomology and biology of certain conditions and behaviors. And so in 1956, we saw that AMA declared alcoholism as an actual illness. So prior to that, alcoholism was not really classified as an illness until 1956. And then 1966, it classified it as a disease. Okay? And then we had Harold Hughes, who founded the National Institution of Alcohol Abuse and Alcoholism. We have the Hazelden, and Hazelden adapted the 12-step approach. And so we know the 12-step approach really looked at the 12 steps, and those 12 steps is what brought a person that was in AA meetings or part of the AA group or structure to go through those 12 steps. And those 12 steps, at each step, that person was to accomplish those 12 steps. So like the first step, admit you have a problem. And so anyone that was attending 12 step actually went through the 12 step group. And then during the U.S. prohibition, your text talks about prohibition, and that prohibition time period was like 1920 to 1933. And during this time, crime was kind of glamorized. You had the mafia, you had homicide rates that increased. You had the Great Depression, which created a need for jobs. So you had a lot of things happening during that time. Also, you had modern war on drugs. And so modern war on drugs, you had Johnson, who declared war on poverty. Nixon, through the Bushes, declared the war on drugs. And then 1960s, you had the heroin horror stories where many people were overdosing on heroin. And now today we have a reoccurrence of individuals that are overdosing on opioid and also derivatives of opioid and heroin. And so the 1980s, we had the crack cocaine epidemic, Whereas, and then not only did we have the crack cocaine epidemic, but we had where more or less African Americans were actually incarcerated because of the crack cocaine epidemic and the whole declaring the war on drugs. And now 2000s, we have the methamphetamines that are so prevalent in attacking our communities, and sometimes these attacks are directed towards the poor and minorities. Your book talks about. And then towards the end of that chapter, it talks about harm reduction. And harm reduction were different programs that were instituted to help alleviate the substance abuse issue. And so these were programs that look like inpatient treatment, outpatient treatment, 12 steps. Also, you had Al-Anon, family and friends, that were also a part of the process for harm reduction. But then we saw how heroin was when heroin was prescribed. You saw like the needle exchanges in the U.S. where if you were actively using, it was where you can come and get clean needles as a part of harm reduction. And we saw a really increase in HIV and AIDS as it relates to substance abuse and the transmission of HIV and AIDS through needles. And so then we started looking at, let's do needle exchange programs. And so really we still have reduction programs that we look at throughout the United States. And so chapter 3, we're talking about substance use, misuse, dependency, and the body. And so we know recent trends in substance abuse as it relates to the biology of the body. We had the development of PET scans, or functional magnetic resonance imaging, and these were different, or MRIs, different instruments that was utilized to look at the brain and understand how the brain developed, how the brain looked with someone that was a substance abuser on drugs. And so we have recent trends that are now telling us more about brain function and how it relates to body development and outcome behaviors. We had the craving research. We have connections between addiction-related behaviors and neural structures and functions. So now we're not only looking at the connection between addiction-related behaviors, but also neural structure, how the brain function, how alcoholism actually affects the functioning of the brain. New facts on brain damage as well. Depressants. When we talk about depressants, there are many different types of depressants, and alcohol is considered a depressant. You may drink alcohol and feel great, feel kind of mellow, kind of sedated like, but then after those effects are over, it can act as a downer. So sometimes you see people that after they drink, they get very emotional, they have crying spells, they begin to cry because it acts as a depressant. Barbiturates and tranquilizers as well. Your text kind of gives some statistical data as alcohol toll, the homicidal, drowning deaths as it relates to crashes, date rape, child abuse, neglect, and suicide. I'm not going to go over some of the international studies, but your book definitely talks about, show how correlation relates to some of these incidents and how it relates to other international studies. Partner violence, both offender and victim are drinking. We know that there is an increase in partner violence, especially when both parties are drinking, or we know that sometimes women or men experience violence when one party has been drinking and drinking excessively. Also, college student deaths per year, 1,825 injuries to 6,000, according to the National Institution of Alcohol Abuse and Alcoholism. One During the 1972, Martin was someone that taught about alcoholism and also explained in collaboration with the 12 step what a person needs to do to actually be to recover from alcoholism and receive treatment. I will put a link of one of Father Martin's videos, a small video, so that you can have the opportunity to review that. When we talk about global drinking patterns, we know that the Europeans consume 6 times as much alcohol as Southeast Asian. We know places like Moldova, Czech Republic drink around 18 liters per capita each year. That is an excessive amount. I actually visited the Czech Republic last year, and everyone, mostly every restaurant or the citizens of this country, really the main thing was beer. So they had many different types of beer, and that was something that they actually consumed. Eastern Europeans consumes more or less hard liquor, British and Irish beer, French and Italians wine, and then high rates indigenous populations, North Sweden and North Canada also consumed high concentrations of alcohol. Health effects of moderate drinkers, we know that there are heart benefits, live longer than teetotalers. Teetotalers was talked about in chapter 1. 7 to 10% of drinkers get addicted. And so when we talk about addiction looks at tolerance. Intolerance has to do with how much alcohol you can consume, and normally the tolerance level increases from the time you begin to over a period of time. So you was able to drink one beer and feel kind of something from that beer, but then as time goes along, as you continue to drink, your tolerance continues to increase. And so today you might need 10 beers to feel like you felt when you first started drinking with that one beer. Withdrawals looks like tremors, it could be nausea, and DTs are delirious tremors. And then so also heavy nicotine and alcohol use. Then you have tolerance reversal. Tolerance reversal could be where something changes and your tolerance you may not be able to consume as much as you were and still feel that effect. 0.4 blood alcohol concentration may be comatose. Blackouts common at 0.3 blood alcohol. If we look at narcotics, we know that opiates, opium poppy was traditionally, historically, what it was titled. Heroin can now be smoked, snorted, and now folks are developing a high tolerance develops, so greater quantities are needed to produce the same high, and that's kind of what I was describing with tolerance. So now we have inhalants. Inhalants are things that people sniff or inhale, and so some of that stuff look like household products, huffing, and these things can cause severe brain damage and even put somebody in a coma. Misuse of pain medications are increasing today, and so we know that a lot of back injuries, a lot of knee replacements, those type of injuries, pain medication has been prescribed. And hydrocodone is one of the pain medications that's been prescribed, and it has become a misuse. And even today, we have a lot of the population worldwide has misused pain medication. We have the oxycodone or Oxycontin developed for patients with cancer. But we know that OxyContin has been abused in across the United States. Then we have stimulants, and these are drugs that stimulate us. These are drugs as it relates to the brain. It's these release certain neurotransmitters that causes you to be stimulated. So crack cocaine, crack, and powder in the urine for 8 hours, smoke for faster high. Highs last only about 15 to 20 minutes, and it's an unpleasant crash. So when you come down off of it, you really feel terrible. But one thing about crack cocaine, it doesn't have any physiological physiological ailments like withdrawals, like alcohol from withdrawals or opioids. And so crack cocaine, you just crave the next high, but you don't really go through any physiological as it relates to unpleasant withdrawal symptoms. Then you have brain blocks reuptake of dopamine. And there was a study that was done, and it was addicted rats died to seizures or dehydration. And so they chose food and water. And so that study was done. It was to try to understand if we block some of the dopamine transmitters, how that would affect someone that would actually go through some type of withdrawals. Then you had amphetamines or meth, and these are synthetic, unlike cocaine. They increase your adrenaline, they increase your heart rate, but it suppresses your appetite. And then we have powder, can be snorted, injected, stay awake for a long time durations. And anhedonia is a symptom, and it's really the inability to feel pleasure with drug-induced brain injury. So you don't really feel the pleasure. For instance, depression, you feel the symptoms of depression. You feel sadness, you feel hopeless, you feel despair. But anhedonia is just that you just don't feel inability to feel pleasure. So you just kind of like a blank slate. Nicotine both stimulates and relaxes depending on your emotional state. Nicotine decreases your blood alcohol level. And now we know that there's cases of chewing tobacco, and also snuff is a form of nicotine. Hallucinogens, plants as medicine such as LSD, PCP, these are synthetics, and they cause flashbacks. They can cause hallucinations. You have ecstasy or roofies. You have also some of these studies have been done looking at post-traumatic stress disorder as well. Okay, if we talk about ecstasy is a drug that has some hallucinogenic properties in it. And so the short form chemical name MDMA is the drug that is the active ingredients that's in ecstasy. And we know even today there are some instances where young adolescents are snorting or smoking LSD, PCP, and ecstasy. Now, some of the short-term effects of ecstasy is feeling of confidence, sense of arousal, increased heart rate, dry mouth, throat, tension, high body temperature, muscle twitching, and also depression and confusion. Some other synthetic substances are spice, bath salts. We had a really bad occurrence of bath salts where that were reported throughout the news in different areas of the world where people were attacking other people, even like cannibalism in a sense. And so we saw an increase in ER visits associated with this drug, and sometimes it's hard to detect. It produces intense cravings, and the contents are really unknown. Then we have cannabis. cannabis, marijuana, and then the active ingredients in marijuana, it's called THC. And this is the psychoactive ingredient that's in cannabis, and it lowers your blood glucose level, it increases your appetite. So a lot of times people smoke marijuana, they get cravings. It's stored in fat cells, long-term use possibly associated with apathy. And then some early reports of lung cancer after long-term use were not validated. So early on, reports or studies showed that lung cancer, but then after extensive research, it showed that these facts were not validated. And then now we have medical use of cannabis, and psychiatric use. And today we even have what's CBD, which is another ingredient. However, it's not the psychoactive ingredients that's being utilized. But we know today we use marijuana for glucose. We use it for cancer patients, glaucoma. Also, cancer patients with pain utilize cannabis. We know the cost to get high it differs from different region to region, state by state, and from really all over the world, the country. Crack cocaine, $5 to $10. A quick fix lasts about 30 minutes. Heroin, 100 to 200. Ecstasy, 25 for so many pills. Meth, $25. Marijuana, 25 or higher, depending on the quality. Metabolism, and so we know, understanding how alcohol is, or drugs or substances are metabolized, and so we know that they're metabolized through the liver, the organ that metabolizes alcohols, and it circulates in the bloodstream and until it's metabolized in the liver. So we know when someone drinks an excessive amount, we know one of the conditions that they suffer with is cirrhosis of the liver. Men's alcohol destroying enzyme work better than women. People metabolize half an ounce per hour, so that, which is equal to a small glass of wine. One drink, 1/4, one bottle of beer, 12 ounce, 1/4 glass of wine, 6 ounce, and then 1/4 single drink, 1 ounce of liquor. We know that blood alcohol content, how it's metabolized in the blood, aldehyde and antabuse. Antabuse is also there's a drug that's titled Antabuse, and Antabuse is given to someone that is addicted to alcohol. And what that drug does is, when they consume alcohol, it makes them sick, it increases their heart rate, it almost makes them feel like they're having a heart attack. So we know also Tylenol plus alcohol can cause liver failure, so you definitely want to make sure that if you're drinking, you're not using Tylenol. And Valium is used to bring one down from cocaine. So if we were to look at the brain and different parts of the brain, we know that this part of the brain, we have movements. The frontal part of the lobe of the brain is where you have judgment. The reward here is where the reward takes place, and memory takes place, sensation, vision in the back, coordination also in the back part of your brain. Ecstasy in the brain. So we know that these are part of the brains that affect ecstasy. Your neocortex, your basal ganglia, your amygdala, your hippocampus, which is in the back part of your brain, and the hypothalamus. These are all parts of the brain that ecstasy affects. The brain and addiction. We know that we have neurotransmitters, and neurotransmitters are like chemicals that are released in the brain, whether they are to make us feel good, they bring us down, they make us feel sad, but these are called dopamine. And so dopamines are the neurotransmitter affect emotions and memory. So dopamine, and then we have dopamine receptors. Memory and craving. So we know certain parts of the brain that drugs affect our memory, and it also increases cravings. So addicted addicts never get original high. Brain has changed. Addiction is a brain disease. So now today we classify, remember early on we said that alcoholism is now considered a disease. And so because it alters the brain, it affects your memory, it affects your behavior, and it affects biologically. Pictures of alcohol beverages activate certain areas of the brain. And we know that Prozac is a drug that's utilized to reduce cravings by regulating serotonin levels. And your serotonin levels is what makes you feel happy or sad. And so when you don't have enough serotonin, you may feel down and depressed. And when you have too much, it does another effect. So here we have cocaine in the brain. And so you have your transmitting neuron, which is your dopamine transporter functioning normal. And then you have dopamine transporters that's blocked by cocaine. And so your dopamine receptors receiving the neuron. So if your synapses in these neurotransmitters are not firing like they should, it causes other problems with someone's functionability. Gambling and the brain. A person with a gambling disorder may have abnormal levels of dopamine and serotonin. Lack of control may result, and that's why you see a lot of people that, they spend their house note, they spend their utility bill money because of lack of control results. Highs enhance when rewards are uncertain, and and near misses especially thrilling. So when someone wins, that part of the brain is excited. That part of the reward system of the brain is excited, and it wants to continue to experience that. And that's why you have addiction that forms, and you have brain neurotransmitters that begin to release abnormal levels in the brain. So we also have role of genes. And so there was studies that were done in mental health hospitals, prisons. 50% who used chemical substances had mental disorders. And that's where we get the term co-occurring disorders or comorbidity. Co-occurring. We have two things occurring at the same time. Kollinger, Sweden, 259 males, adoptees with alcoholic fathers. And so two types were identified. Type 1, late onset of alcoholics, relates to harm, avoidance, anxiety, and guilt. And then you have type 2, risk taker, starts at about age 11, male, hyperactive, antisocial, hereditary. And so if you look even in your own family history of how alcohol, if you have any alcoholics or alcoholism in your family, if you look and kind of look at the different types, you may identify some people in your family or friends that relate to one of the two types. Some medical consequences. Werner-Korsakoff syndrome, and so this is like a deficiency of vitamin B1. This is actually alcoholism affects different vitamins within the body. Cases reported by Dr. Oliver Stack. Peripheral neuropathy related to a lack of vitamin B, and this is like a stiffness in the body. Confabulation also is a medical consequence. Liver damage, like we said, removes toxins from the blood. Bile circulates in the bloodstream. Sometimes yellow skin tones, cirrhosis of the liver. Heart, nicotine, cocaine, because smoking sometimes increases the blood, or it can increase blood vessels and block the blood flow of blood flowing to your heart. Fetal alcohol syndrome. We know fetal alcohol syndrome affects a mother that is pregnant and she consumes alcohol. Then there are certain distinctions of fetal alcohol in a child, such as short nose, indistinctive grooves between the nose and mouth, thin upper lip, small head and eyes. Sometimes their earlobes are lower than normal. And so a roll of sperm should be considered as well as mother's roll as well. And so interventions related to biology, we know that now we have many different interventions that's related to biology. We have aversion therapy, drink aversion therapy, anabuse. That is something that's given, and so it induces those symptoms that are related to even a heart attack to deter one from drinking. And then changing brain chemistry, how your brain locks, cognitive treatment for OCD. So we know that addiction really is a type of compulsive behavior, and so cognitive behavioral therapy is to help rewire the brain, to help someone think differently about their cravings and their behavior. On Danstrone, decreasing cravings, Zyban, and smoking. Nicotine gum, we have patches. Naltrexone, approved in 1995, and this is not a narcotic, unlike methadone, and so it blocks receptors for getting high. And then we have synthetic prescription drugs such as methadone. Methadone is usually to treat someone addicted to heroin, and it's the synthetic form of heroin. And so we have methadone maintenance. We also have methadone clinics that are allow people to come take their methadone at the clinic, and normally they come maybe every day or a couple of times a week to get their methadone. Heroin maintenance in Britain, Switzerland, and Vancouver. Buprenorphine can be described, also reduces likelihood of overdose, eating disorders, and dopamine. Bulimics related to depression, anorexia, and so you have Luvox, Prozac, and Paxil also helps decrease binges. And then we also look at holistic treatments such as herbal remedies, St. John's wort, hypnosis, acupuncture, massage therapy, and physical exercise to reduce tension. Thank you.